for this particular problem, I'm going to work on some acupuncture points that are on the bladder meridian. Now, you go, what is a meridian? Okay, here we go. And we're applying it in right there. You okay?
Mm-hmm.
Feels
Yeah.
good? Okay.
Yeah.
Now, a lot of people want to know, does it hurt? And I'm not going to lie to you and say there's no pain involved, but it's very minimal.
There was a little burn, but I didn't know if it was maybe the alcohol when you first initially heard sometimes that pain.
Yes. And this is so much less than if you were to get a shot, a hypodermic shot from your doctor. And a lot of the times I'll have patients that'll go, hey doctor, are you gonna start? And I go, well, you have 6 needles in you already. And they go, wow. So I don't want you to fear the pain because it's not a painful situation. In fact, it's pretty easy.
I've only felt one of them going in. I don't know how many are in there now, but
There's 3 in right now. Now he does have a tight muscle in this area, and he is a fit man with good muscle tone, so sometimes the needles go in easier than other times, but these are going in quite easy. Now, another thing that people wonder is, well, how do you know where to put the needles? Well, we have acupuncture points, and there's well over 300 of them that we know exist, but they run along these lines in your body. Remember I told you about the energy highway that we have, and they're called meridian lines. And so each major organ in your body, like the heart, liver, lungs, kidneys, they have their own set of a line that has the acupuncture points on them. Now, I've talked to you about the bladder. The reason I'm doing bladder, oddly enough, the bladder starts at the top of your body and goes all the way down to your toes. It's the longest meridian in your body, I believe, I'm not mistaken, 64 points. Now, the heart has much fewer, and it goes down your arm. So they're in different places that don't always correlate precisely with the organ, but they're mapped out that way. And so, in this particular case, I'm doing the bladder rim because that's where his problem is. Now, in addition to this, a lot of times you'll do points elsewhere in the body, and we call them distal points, for instance, like on his ankle. And this sort of pulls the pain away from the area, but because he's wearing jeans, and we're not gonna go there today, we're just gonna do a local application. So the whole point of this is that we're gonna restore chi energy, and we're gonna allow this to start functioning better, and when that happens, inflammation will go down, and his pain level will go down. Okay, a general treatment can take anywhere from 10 minutes to 30 minutes on the average. What makes it determine what you want to do is what your goal is with this. So if you're trying to sedate an area and make it less painful, less irritated, you're going to go a little longer. If you're trying to tonify, you got an area that needs energy, and you're just trying to get it working faster, better, then you can do a lesser treatment. It didn't take quite as long. But in this time, we're trying to quiet this down. Like I said, the Chinese have funny ways of saying things, and they'd say, oh, this is angry, this is, because it's giving off a lot of heat and a lot of energy. So you're trying to quiet that down. You know, if you've ever gone to a martial arts studio and you see the wheel on the wall, the black and white wheel, it's called yin and yang. Well, that's chi energy. And a yang energy is external. So I'm kind of treating a yang energy right here. And a yin energy is more internal. So I'll give you a perfect example. Let's say you had a strep throat and your throat was killing you and it was so hot and you had a fever. That's a lot of energy, and we call that a yang energy. And we're trying to, you'd want to quiet that down. You'd want to get that throat to be less painful. On the other hand, let's say you had bronchitis, and man, it's 85 degrees outside, but you're freezing, and you're sitting in the corner in a sweater wearing a shawl, and you're coughing. That would be more of a yin problem, and you want to bring more energy to the lungs and to the throat. So you would do a treatment that would allow that to happen. So there's 2 different reasons. The last thing you want to do is, if someone's on fire and in a lot of pain, is make their pain worse. You want to make it less. So it just depends on what you're after. Generally speaking, when you do a treatment, The patient will usually be very relaxed. Sometimes they even go to sleep during your treatment, or they'll be very, very relaxed when you're done. Most of the time, I will tell them, hey, if you feel like you need to go rest for a while after a treatment, then that would be the appropriate way to go. I've had other patients to get off the table and go, wow, I feel great, and they are more energized. It's just everybody's different, and it depends on what you're dealing with. Somebody said, well, how long does it take? Well, like I said, this treatment's going to take about 20 minutes, but not everyone just jumps off the table and says, Eureka, you've cured me. But what I usually tell them is, oddly enough, during the course of a day, usually 3 to 4 hours later, you'll start feeling even more of an effect of the acupuncture, especially when you're dealing with neuromusculoskeletal problems. Dr. Hassel, do you have any questions for me?
No, but I have to